welcome back to Health Hush, your trusted source for all things related to women's health. Today, we have an important topic to discuss: genital herpes in pregnant women. It's a topic that deserves our attention as it's vital for the well-being of both the mother and the baby. So, let's dive right in. When it comes to the diagnosis of a primary episode of herpes infection during pregnancy, the first step is to differentiate between primary and recurrent infections. This is crucial because the management and precautions differ. Now, here's the twist. If a patient develops what seems like a first episode of genital herpes in the third trimester, especially within 6 weeks of delivery, it can be a bit tricky to distinguish between recurrent and primary herpes simplex virus infections. To clear things up, medical professionals use techniques like electron microscopy, polymerase chain reaction, and culture to identify the virus and its type based on swabs taken from the ulcer. But that's not all. Type-specific HSV antibody testing, measuring IgG antibodies for HSV1 and HSV2, is also conducted. Here's why it's important. If it's a recurrent infection, the woman will have antibodies matching the virus in her genital swabs. But if the antibodies are absent, it's a primary infection. Now, let's talk about the management of genital herpes in pregnant women. The good news is that HSV infection doesn't increase the risk of congenital abnormalities. Typically, treatment involves oral acyclovir 200 mg 5 times a day for 5 days and analgesics. However, acyclovir should be used with caution before 20 weeks of gestation. When it comes to delivering a baby, when the mother has a primary episode of genital herpes in third trimester, it's a bit different. The best approach is a cesarean section before the rupture of membranes at the time of labor onset or within 6 weeks of the expected delivery date. This minimizes the risk of neonatal herpes transmission. And what if it's a recurrent episode of genital herpes? In this case, the pregnant woman will have IgG antibodies to the virus, which will pass on to the fetus across the placenta. This provides the baby with protective passive immunity. So, a vaginal delivery is usually the most appropriate method. That's the lowdown in genital herpes in pregnant women, dear viewers. Remember, early diagnosis and proper management are key to ensuring the safety of both the mother and the baby. Thanks for joining us on Health Hush today. If you found this information helpful, don't forget to like, share, and subscribe for more insightful content. We are here to keep you informed and your health in hush. Until next time, take care.